Welcome to Clinical Lab Chat, part of the MedCore Podcast Network. I'm Chris Wolski, Director of Business Intelligence for CLP, and today I'll be speaking with Jonathan Brennan-Badal, CEO of OpentronsLabWorks, about the rise of robots in clinical labs. As the leader of OpenTrons, Jonathan has established a presence for the company in the industry, developing innovative technology and supporting the Lab 4.0 movement. Prior to his work at OpenTrons, Jonathan was the VP of Strategy at Comixology, where he managed the company's business and corporate development initiatives. And that company was later acquired by Amazon in 2014. So, Jonathan, welcome to Clinical Lab Chat. I'm really looking forward to discussing all things robotics in clinical labs with you today. I think you're the guy to talk about this. So let's dive in here. So AI, automation, robotics, these seem to be the big trends I'm seeing this year in the clinical laboratory space. I've written several articles already in the early part of this year. And so I'm seeing this as a big trend, but I want to talk to you, kind of drill down a little bit. For you, what's the biggest trends in robotics and the clinical lab manager should be keeping an eye on?
Yeah, absolutely. Two of the biggest trends that we've been seeing in robotics is one, that the fundamental robotic systems become far more affordable, far more mass manufacturable. Mm-hmm. And second major trend is that robotic systems are more easily programmable. Okay. And I'll kind of expand upon both of those kind of trends to give kind of a sense of why that matters for clinical lab managers.
Right.
On that affordability front, many of the key components that go into robotics platforms are being much more kind of mass manufactured and as a result can be made much more affordable.
Right.
And that's a trend that certainly OpenTrons has been leveraging that enables us to build very high quality instruments like our new Flex robot, but provide that at significantly more affordable prices for lab operations. And the net effect of that is that it makes a lot more sense for more labs to be adopting robotics and for labs that have adopted robotics to more extensively automate their operations. And so this kind of trend towards more ubiquitous kind of robotics is something that is something we've been seeing.
Right.
The second major trend centers around kind of the ease of programming these types of systems. And one of the biggest constraints, aside from cost, has been that programming these robots to do the exact specific protocol or application in mind is oftentimes a challenging project and oftentimes kind of a main bottleneck for the adoption of these types of systems.
Okay, great.
And on that front, we've been seeing a lot of tremendous progress on technologies like ChatGPT and other LLMs that can greatly kind of assist or accelerate the programming of these types of systems.
Right. Well, and talking about that, it's interesting. This kind of dovetails on my next question. I interviewed another company recently. I won't bring them up. I suspect they're one of your friendly competitors. And one of the challenges they faced, in a general sort of way, is that labs are really interested in robotics and automation, but they really can't see, they can't really make that use case probably to, the procurement folks or the leadership. Mm-hmm. So what is the use case for robotics in clinical labs? And you kind of touched on it a little bit with what you're talking about, the lower cost, but what kind of ROI should lab managers and healthcare enterprises be expecting with robotics? I mean, is this something you just have it and that it's a cost of doing business, or is there an ROI on that? So what is the use case and what's the ROI on this?
Yeah, absolutely. So, the principal use case is to be automating, common activities in your clinical lab. And so that could be running a NGS library prep and doing your sequencing.
Right.
And that might be an activity that's very labor intensive, potentially error prone. And by automating, you can simultaneously increase your throughput of the number of samples you might be running. Second, the reducing the costs associated with that sample prep, as well as reduce kind of your labor costs associated with that work, particularly on a kind of per sample basis. And particularly as you look in other more nascent areas of automation, like let's say, automation of, iPSC growth or other kind of cell culture kind of automation, those are really kind of complex areas that are rife with issues of throughput as well as accuracy. And so adoption of automation can greatly streamline and make your operations much more accurate and efficient. In terms of ROI, it obviously is a function of the type of automation instruments that you choose to adopt, as well as kind of how well you kind of utilize them. I can certainly speak with from OpentronsCEO's experiences as kind of a leader both on quality, throughput, and pricing with our Flex robot. Many of the labs that have adopted our tools have typically seen paybacks, as short as 3 to 6 months.
Oh, wow.
On systems, and this is kind of why I kind of called out. It's really kind of important to be kind of thoughtful on what you're automating and how you're kind of automating it. And by using kind of affordable solutions like our Flex robot, you can be automating common activities that might be labor intensive, just like basic sample reformatting or other sets of things like that might be fairly straightforward but time consuming, or use our type of systems to be automating, plates of NGS library prep or other more complex assays. And by automating those sets of activities, you really can be freeing up your lab tech's time, and ultimately enable your lab to take on more activities or greater throughput of activities while leveraging that same personnel base and overall infrastructure.
Right. But the thing is with automation, though, too, as with anything, you really kind of know what you have to know what you're getting into. You just don't go into this blind. You have to be doing your due diligence. So what kind of due diligence should labs be doing maybe as they're looking to automate? And I would imagine those folks who are getting that return in 3 to 6 months, they have done their due diligence. They have a plan. They're implementing this, and certainly it's your solution, right, in the example you're giving. But they are having the plan. If you just walk in, just give me a robot, and I have no plan of how I'm going to work into my workflow, there is no ROI. I mean, it's a recipe for disaster. So how should a lab manager at least start the due diligence process or start that planning process to plan for automation?
Absolutely. And so, the first piece of advice that we give our kind of customers is don't try and automate everything. Don't try and automate an entire pipeline at the get-go.
Right.
You can automate piece by piece. And first taking that kind of framework really kind of reduces the risk and complexity of adopting automation. Pick off what is your most error-prone or most labor-intensive activity in the lab.
Right.
That's probably a good first place to start, and the place that you'll see the highest ROI.
Right.
By focusing on that and making it a much more focused and discrete problem, you can focus on deploying a single instrument to be automating that particular activity, getting that specific technician that was responsible for that portion of the pipeline well familiarized with that tool and successful with it. And then you kind of have that as a starting template in which to then automate another piece of that pipeline or take on an additional pipeline that you're looking to automate. And doing it kind of systematically but piecemeal will make it far more kind of approachable and allow you to really evaluate the ROI and the efficiency and productivity gains before you kind of continue to expand your automation.
Right.
And that's what we've commonly see with our customers. Well, they'll start with buying one robot, automating a piece,
Right.
but over the course of a year or two, they might end up ultimately utilizing 5 or 10 of our systems to really extensively automate their operations.
Okay. So tell me about OpenTrons. How are you helping labs automate? Certainly, it sounds like you are helping your customers, or we probably wouldn't be talking right now. And what makes you different than other robotics companies? As I mentioned, I spoke with probably one of your friendly competitors recently. So why don't you tell me a little bit about OpenTrons and what makes you stand out in the market?
Yeah, absolutely. And so, we previously kind of touched upon the affordability of our platform. We're a company that really focuses on driving innovation to provide high quality but affordable solutions and passing on those savings to our customers. That's obviously a key benefit because obviously the lower your amount of investment, the quicker your ROI.
Right.
The second key differentiator is the flexibility of our platform. It's really challenging from an ROI perspective or from an employee kind of training perspective if you need to have different instruments to run different activities in the lab. It's a lot more helpful if you can kind of standardize around a platform and leverage that flexible platform to be automating a range of different activities. For a very budget constrained or smaller clinical lab, you can be using a single instrument and have it automate multiple different workflows. For higher throughput labs that want to have a dedicated device, it's helpful to have multiple kind of dedicated devices for different steps in a process. And OpenTrons, because of the flexibility of our platform, the end user can reconfigure a robot within literally minutes to be automating a wide range of different workflows or activities in the lab.
Oh, wow.
And so that flexibility really simplifies the training of employees and also simplifies the deployments and management of these types of automated pipelines.
Great. Now, I think the biggest fear, in my world, I'm in the media world, editorial world. We have fears about robotics and AI automation. I think there's been some fears in other areas as well. I think even the labs, even though there are benefits, there are some fears that AI and automation, robotics are going to minimize our humanity. They're going to make us obsolete. So, in your view, how does robotics fit into the bigger picture of the lab and beyond, and maybe throughout the whole healthcare enterprise?
Yeah, absolutely. And so, it's my view that automation is actually going to be key to bringing the humanity back into lab work. There's so much tedium of running some of these routine activities, and people can be so better served by working on kind of higher value problems. And so I'll give you kind of, in the broadest sense, there's on the order of several million life scientists worldwide.
Right.
If you think about what would it mean to 10x the scientific output of humanity over the next few decades, there's probably really a lot of amazing problems that could be solved. It's far more reasonable to imagine the next couple of decades looking like, hey, we've have 10x or 100x the amount of robotics that we're using, and so as a result, we're able to run 10x or 100x more experiments and drive new discoveries than it is to say we're going to train another 30 million PhDs over the next decade.
Right.
And so fundamentally, I think robotics is going to very deeply kind of fit in and complement scientific progress. The second other piece I'll kind of say is that automation also allows you to bring down the costs and as a result be able to do more with the same amount of kind of resources. And I'll use kind of an example at OpenTrons. And so working with the city of New York, we set up 40 of our robots which ran the majority of all COVID testing for New York City.
Oh, wow.
And so to kind of put that in perspective, we had a 2,000 square foot lab that was able to run north of 100,000 samples of COVID samples a day. And what's amazing about kind of automation is that we were able to 10x or more kind of the throughput of our lab operation through the efficient usage of robotics. And not have to figure out insanely impossible things of how do we 10x or 20x our lab staff for short periods of time to handle these kind of surges. And so I think we'll find by leveraging automation and affordable automation, it'll also allow us to scale up certain kind of activities. And do so in a way, and solve types of problems that just aren't, possible. Provide the example of a surge in samples that need to be run because of a pandemic. But you can also see that, just as applicable to bottlenecks with, the production of gene therapies and things like that are very kind of complex, bottlenecked processes.
Right, for sure. All right, we talked a lot about the advantages of robotics, and what are some of the challenges? I think we kind of touched on those a little bit with planning, but what are some of the just general challenges with robotics in clinical labs in general?
Yeah, and so I think the biggest challenge, with robotics in labs, and I'd argue actually with lab operations in general, is there's a lack of standards. Hey, every single reagent, consumable, process needs to be tested out and demonstrated that it's valid and concordant with some other method, right? And this is really, really kind of a challenge for clinical lab operations, because so many of these clinical activities are piecing together a range of different instruments, automated or not, and needing to demonstrate the efficacy, concordance, what have you.
Right.
So that, I think, is a general challenge within clinical labs, but I think also in particular with robotics in clinical labs, because then the robotic system is just yet another system that you need to be demonstrating, concordance to.
Right.
So I think that has been perennially one of the bigger challenges to be adopting robotics. Hey, it's a big effort because we have a manual process that works. Well, now if we want to add a robot, it's not just automating the activity. You have to demonstrate the concordance with that manual process.
Right.
And that's why I kind of really, really talk about is having a flexible system, one that really reduces the friction associated with programming a robot. That really reduces kind of the effort and time associated with not just automating the activity, but also demonstrating the concordance with, a manual kind of benchmark. And if you can really kind of simplify that type of experience, which is something that we're very kind of focused on, I think that that's one of the biggest kind of challenges that over the coming years can be greatly reduced, so that it can be as seamless as possible to transition a manual process to an automated process, or even potentially have processes be automated first. Because you've made automation affordable and easy enough to use, that actually just makes sense, even at low volumes, to have a activity be automated from the get-go. And then you have the confidence of scalability, accuracy, and so on and so forth.
Right. Gotcha. All right. So I always like to end on a forward-looking note. I always like to look ahead. So what's next? What's up for the next 5-10 years? What does that look like for robotics in the lab and healthcare in general? Are we getting ready for a revolution here, or is it a gradual implementation? What's going to happen over the next 5 or 10 years with robotics in clinical labs and in healthcare in general?
Totally. I see an incredible opportunity for robotics to be far more ubiquitous and relieve kind of critical bottlenecks within clinical labs, as well as standardize and simplify the operations. And when I look at possible kind of futures, I kind of think of the following. So if you look at life science in general, there's about 10 people that work in a lab to individual robots in a lab.
Okay.
And so when you look at the aggregate of about 4 million folks that work in a lab operation, there's about 400,000 robots. When you look at other industries or other types of operations, that type of ratio is inverted. So I'll just use kind of like Amazon warehousing as an example. The newest fulfillment centers being deployed by Amazon have 10 robots per individual.
Wow.
And that is one of the ways in which Amazon has been able to obviously scale to be a tremendously large operation, and very kind of efficient and accurate kind of in their own rights. And while I would certainly kind of characterize the problems and challenges within a clinical lab operation as being more sophisticated than, say, like a warehouse in some respects, I think that should be kind of a good kind of mental model of what 10 years from now ought to look like if we really are doing an exceptional job and having the best possible kind of clinical operations. And it's my view that instead of having 400,000 robots to the 4 million lab techs, scientists, et cetera, that live in life science, you might find that there's potentially more robots than people, and that's actually a great thing, because that's a means for unlocking more discovery, more innovation, enabling more, relieving bottlenecks on hard to execute activities like growing iPSCs and other things,
Right.
and enable those individuals to be focusing on higher value and more intellectually stimulating kind of activities.
Right. All right. Well, unfortunately, we've come to the end of our time. Jonathan, thanks so much for spending time with me. I'm feeling a lot better about the robot revolution right now. So I think you've given us some good food for thought and some great perspectives on robotics in the lab. I also want to thank you, the laboratory audience, for listening. Look for more episodes of Clinical Lab Chat in the future, and visit us online at clpmag.com and on all those major social media platforms you may go to during the day. Until next time, be well.